Have you heard of collagen banking?
Collagen banking.
What is collagen banking?
I've been getting lots of questions about collagen banking.
Should we be collagen banking? Yes, absolutely we should.
Collagen bank moisturizers.
We all start to lose our collagen from our mid-20s on.
Collagen banking has always been something that I've been a believer in.
If you want to start investing in your skin, look into collagen banking.
Folks, if you're serious about keeping your skin from aging or restoring your skin to look more youthful, you're gonna wanna know everything there is to know about collagen and this new concept called collagen banking. Once you understand this, it'll put everything that you do for your skin in perspective. That way you make great decisions and really get to the bottom of what you actually need to do to improve your skin. So let's get into it. Hi everyone, I'm Dr. Amir Karam, board certified facial plastic surgeon and founder and creator of KaramMD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And on today's episode of Skin School, I'm delighted to be able to share a concept that has been foundational to me for the last 20 years and has now caught on a very, I guess, catchy kind of a term that's floating around all over the internet and in printed media. And when I heard about it, I had to ask, what is collagen banking? This is exactly what I've been talking about forever. And really, this is the whole concept of the KaramMD trifecta. It was a delight for me to hear that this is a term and a concept that is catching on. So you know what's coming up. I'm gonna basically talk about 5 things. Number 1, what is collagen? Number 2, what is collagen banking? Number 3, when should you start doing collagen banking? And number 4, how do you collagen bank? Both things you can do at home as well as things you can do in the office. And 5, and you don't wanna miss this, what are some collagen banking concepts and treatments that actually don't work? This is key. So without further ado, let's break it down. So number 1, what is collagen? So collagen is a protein. It is made up of amino acids. It is the structural protein that is found ubiquitously throughout the body. In almost every piece of tissue in our body, there's collagen. Within our fascia, cartilage, your skin, almost every tissue in the body is held together by the fabric of collagen. But specifically when it comes to the skin, which is what we're gonna talk about, collagen in the skin makes up the bulk of the dermis. There's other proteins involved there as well, structural proteins like keratin, etc. But the foundational protein is collagen. And why it's so important is this: collagen slowly but surely diminishes from the age of mid-20s through the rest of your life. So what does that mean? Basically, it means your body produces less and less collagen. What is producing the collagen? There are cells inside the skin called fibroblasts. Fibroblasts produce collagen. And when those cells age, they start to produce less and less of it. And what is the manifestation of that decrease in collagen production at the fibroblast level? Is skin aging. When you look at old skin compared to young skin, you notice some notable anatomic differences. Young skin is thick, it's supple, it has a turgor to it, it's an integrity to it. Aging skin, on the other hand, begins to thin. As a result of that decreasing collagen production and decreasing collagen supply in the skin becomes thinner and thinner and thinner. We see this microscopically when we look at the dermis under a microscope. Young skin, thick dermis, aging skin, thin dermis. And what does that look like from the surface? You can't miss it. Fine lines and wrinkles, crepiness, and overall kind of like a soft sagging look to the skin. Unlike young looking skin where it's tight and firm. And this is something that is so foundational, so important, because if you understand that collagen loss is the reason why your skin is looking old, then everything you want to do to improve your skin, both in terms of if you're young enough to be watching this video in your 30s or even early 40s and 20s even, you'll know what you need to do to prevent collagen from diminishing. And if you're older and you want to restore some of it, you're going to learn exactly what you need to do to increase collagen production, which then leads us to number 2. What is collagen banking? All right, so I don't know if I love the term, but it gets the concept clear. So here's the story. These 3 factors decrease the production of collagen: genetics, being a human being, and one that I harp on a lot, and that is sun. The first 2, genetics can't do much about it. Being a human being can't do much about it. Sun is the greatest accelerator of skin aging. In fact, there's been some studies that show that it might be associated between 70 to 80% of the accelerated collagen degradation, meaning breakdown of collagen, that you can do something about. Every one of us can do something about. That's why I talk about sunscreen, hats, visors, whatever you can do to protect your skin from seeing a lot of UVA sunlight. But even if you do all of that, you're still gonna see some level of collagen loss. So in banking terms, that's like your withdrawal, right? You're withdrawing. If you start out with, let's say, call it 100 collagen fibers in your skin, each year you're losing a few. By the time you get much older, you're down to 10 or 20, right? Withdrawing collagen. On the other hand, there are things that you can do to increase collagen production, deposit collagen. So in banking terms, you're basically adding collagen. So in one way, you're subtracting and you're adding it. And in simple math, as long as the amount that you add is greater than the amount that you lose, you're gonna have a net positive collagen production. So even genetics, even aging, that drift you in this direction. And if you notice the normal collagen curve, you see that there is a downward slope that goes along with collagen production. That drop occurs right around perimenopause and menopause in women. And what does it correlate it to? It seems to be correlated almost directly to estrogen. If you look at the estrogen curve, it follows almost the exact same curve and follows the exact same timeline. So estrogen in women begin to diminish in the late 20s, mid-20s, late 20s, and then takes a steep drop right around perimenopause and menopause. And along with it, so does collagen. So the connection between estrogen and collagen seems to be very, very tight. Now, what you do with collagen banking is if you start the process early, and I advise everyone to send this to some friends and family to learn this as well, because again, it's very valuable information. But if you put it in that perspective, what you're gonna do is you wanna basically prevent this downward drift by depositing collagen. And if you are in your 40s and 50s and older, you're gonna wanna do things that are gonna flip the curve and bring it back up. So you're gonna add to your banking account. So collagen banking is literally the idea of trying to increase the amount of deposits over the amount of withdrawals. So in the end of it all, your skin has a surplus or an increased amount of collagen. Now, it's a brilliant concept, but it's not a new concept. It's, like I said earlier in the video, it's something that I have been fundamentally motivated by in terms of my decision-making, what I do for my patients for the last 20 years, is what I can do to help retain as much of their collagen and help enhance as much of it. And what I've done, historically for them is basically what I'm going to talk about in a moment. But now this concept, in putting it in simple terms that more and more people can understand, gives you kind of a visual of deposits and withdrawals. That's how you're going to win the game of money. That's how you're going to win the game of skin aging. All right? Collagen banking in a nutshell. So number 3, when should you start collagen banking? Well, I think if you follow the graph, you're like, okay, well, you're on a negative trend basically in your 20s. So you can't say, oh, I'm gonna wait till I'm like 50 or 60 to start the process. The sooner the better, because the sooner you do that, the less you will lose. Now, is it ever too late? I did a whole video on is it ever too late to take care of your skin and skincare and all this kind of stuff, so I recommend watching it. But the answer is no, it's never too late, because at any point in your life that you want to start to turn this ship around and actually start to see your skin rejuvenate, restore, you can do that. Is it better to start earlier? 100%. It's 100% better to start earlier. Why? Because the gap between where a 20-year-old skin would be and what your skin would be if you kept doing this since your 20s becomes smaller and smaller, easier to gain, versus you have a longer hill to climb if you start later. But it's not too late and you can always see improvement. In fact, I can't tell you the turnaround stories we've seen on our trifecta patients who've been doing it for 2-3 years consistently over time. At any age, 60s, 50s, 70s even, their skin gets better and better. That's the good news. When should you start caring about this and doing it? Literally right now, starting at this very moment. Why wait? If you care about skin, which I assume is why you're watching this video, then you might as well get on this process sooner than later. So number 4, what are some methods that can be used to improve the amount of collagen deposits? So this is the way I've always thought about it. We talked about genetics, we talked about the fibroblasts, the cells that produce collagen, and it's important that we review this biology before we talk about anything else, because it's the fibroblasts, which is the collagen factory cells. If they decrease, then what you want to do is turn that up a little bit. You want to get the fibroblasts to stop being so lazy, and you want it to get it going again, stimulate it, get it going, right? So how do you do that? So this is where molecular biology comes in. The only way to stimulate a cell to do something is to basically get down to the level of the DNA. right? It's the nucleus. A cell is governed by a blueprint, which is its genetic DNA. If the DNA naturally wants to decrease, that's what it's going to do. But you now have, in this current state of the art, you have molecules that can go into the cell's nucleus and go into the DNA area and turn on the same components that normally in a 20-year-old would produce collagen. So you're basically making the cell think it's a 20-year-old cell and it needs to produce collagen. What those categories of molecules are called, and they sound, this whole thing sounds so high-tech and so elaborate, but it's not. It's been around for literally 40 plus years. That entire group of molecules I call actives, but they come down to retinol or retinoids, so that's like retin A and retinol, vitamin C, niacinamide, and certain peptides. Those are 4 topical, meaning something you put on your skin that it gets absorbed by the skin and then causes the skin to basically start upregulating and producing collagen. I mean, how clever and beautiful is that story, right? I mean, that's modern medicine, modern molecular genetics, beautiful thing. That's how you stimulate it. And to bring it back full circle, that was the foundational reason why I developed the trifecta, because in addition to these 4 actives, which normally take 4 different bottles, retinol, vitamin C, niacinamide, and certain peptides, there's 4 bottles right there. You also need, if you're gonna be comprehensive about the whole story, you've seen me talk about this before, you also wanna decrease pigmentation, although a lot of these molecules will help with pigmentation as well. You also wanna improve moisture, you also wanna improve oil balance, and clean your skin. So now you're up to like 6, 7, 8 individual products. The trifecta basically brought them all together. That was the whole story about it, was to make it simple enough to where you don't have to sit there and think about what are all the different products I need to include in my skincare routine. But here's where it gets extremely important. This was also the foundational reason why I wanted to make it so simple, is because all those molecules that we're talking about working at the nucleus level and producing collagen, well, what happens when you stop using them? The minute you stop using them, they stop producing collagen. So as a result, you start to lose collagen again, right? So if you're gonna do skincare, use the right actives. If you're gonna do skincare with the right actives, make sure you're prepared to do it day in and day out, day after day, week after week, month after month, year after year. There is no other valuable way to approach this than to do it that way. So there is not like, oh, I'm gonna do this for a little while and then stop. And it's gonna explain why in-office treatments, although very, very valuable, have limitations. In the in-office side, what are things you can do if you come to my office, you go to a medical spa office, dermatology office, etc. There are things that you can do to stimulate collagen without putting anything on top of your skin. When the skin sees an injury on the surface of it, it thinks that it needs to repair itself. And the way it repairs itself is by producing collagen and landing it into the skin, because it basically thinks it's cut or done some kind of injury and needs to produce scar tissue. And as you know, scar tissue is collagen by foundation. That's what scar is. So you are injuring the skin, sending a signal through the skin into the fibroblast. Those little chemical messengers get into the nucleus, stimulate collagen, improve the output of collagen. So what you're doing is basically depositing collagen through surface injury. What are things that can give you surface injury? Well, plain microneedling, chemical peel, laser peel. Now, this is where it is super valuable, but also limited. Because just as I said earlier, what happens when you stop doing those things? Well, you get a bump through injury and the repair cascade, but then once a week has gone by, 2 weeks has gone by, you're kind of like done with that, your skin goes back into the loss phase. Despite the fact that you do see a bump with these treatments, it's not a sustained bump. It's not a consistent bump. So it becomes impractical and almost impossible to treat this part of the collagen stimulating curve by doing in-office treatments only. That's my logic behind it. That's why I consider skincare with the right actives as your foundation, and then you use these other in-office things as a booster. Why not? I mean, if you don't mind having a chemical peel or microneedling or whatever it is every 6 to 8 weeks or whatever it is, then go ahead and do it. It's like working an extra job basically and depositing that income into your bank account. Put it again in perspective. If you're doing all this and you're spending money on skincare and you're spending money on in-office treatments, you don't want to basically waste your money and lose collagen by degrading it faster than it genetically would. You don't want to, in other words, speed up the loss. You do that by protecting your skin against sun. If you protect your skin out of the sun, continue doing good active skin care day in and day out, year after year, and if you're motivated and want to do some extra in-office treatments, you've got all your bases covered. That's like personal finance, collagen banking, optimized. Perfection, right there. Number 5, what are some collagen banking treatments and concepts that don't work? Everything I've talked about, I'm talking about skin dermis collagen production. That's where you lose it. There's a host of treatments that have been synonymous with collagen production that literally do nothing for the skin. Things like Sculptra, use of fillers, threads that are supposed to stimulate collagen, none of those are putting collagen production in the skin. They're all putting it in an area like the subcutaneous fat, which basically is below the skin, that really doesn't have any natural collagen in there in the first place and does nothing for the collagen banking concept of the actual skin. So to me, those treatments, I mean, quite frankly, are pointless. They're pointless for what we're talking about here. So don't mistake those treatments with improving the quality of your skin. That's really, really important. Now let's talk about supplements. I've done a whole video on supplementation, and I've also done a whole video on collagen supplements. But let me put it into perspective. Collagen peptides, right? These are commonly used to help with your skin aging. I use them myself. My wife uses them. But I don't use them to stimulate collagen, because normally dietary collagen in any form isn't going to stimulate collagen at the genetic level. There's some possibility of helping with fine lines and wrinkles, overall skin youthfulness, etc., hydration. There have been studies that show that there's some improvement there. The mechanisms aren't quite understood, but I wouldn't put my faith in taking collagen as a way to stimulate it, right? But at the very least, collagen peptide proteins have the right type of amino acids, proline and glycine and hydroxyproline, and the ones that are basically the building blocks of collagen, they're in high concentrations of that. You also need zinc, you also need vitamin C, and you also need copper. So a good well-rounded diet, or at least get these in some type of supplement form to give the building blocks to your skin. Now, like I said, I take the hydrolyzed collagen peptides. I look at it as, well, if it can potentially help, great. If not, I'm just getting a little bit more protein. And if I didn't take it, there are days that I go by, I don't take it, I don't think about it that much. Sometimes I take it, sometimes I don't. It's not like one of those like must-haves. But there's not a day that goes by that I don't use the trifecta twice a day. And if I go out in the sun, I'm using sun protection. Those are my foundations. I don't do microneedling, I don't do chemical peels, etc. I just don't think it's worth that little bit of downtime for me to do that. But again, like I said, my wife does. But I would never tell a patient, and I don't want you making this mistake, to think that you're using Sculptra, which does stimulate collagen, but it's not in the skin, or fillers, which as they're degrading does get replaced with scar tissue, but again, in the wrong locations. That's not where you want to produce the collagen. So if your goal is to improve the quality of your skin, you're not going to improve the quality of skin by stimulating collagen in the deeper layers outside of your skin. That's really important to understand. All right, folks, so in quick summary, the name of the game, the whole reason to apply any type of skincare, to spend even a single dollar on skincare, is to keep your skin looking young. You can't get your skin to look young in the long run without the use of retinols, vitamin C, niacinamide, peptides, etc. Your skin is an organ. You have to be a healthy person. You have to live a healthy lifestyle to get the most out of your skin, for your skin to look beautiful. So lifestyle, low alcohol, high exercise, good sleep, good hydration, good diet, all those things are kind of foundational. Then you take it to the next level and actually try to manipulate the genetics. You're going to do that with what we just mentioned here in the concept of collagen banking. Folks, I hope you enjoyed that. I really, again, I feel like if you understand this, that'll put everything in perspective. If you want to learn more about the trifecta, make sure you check out our website at KaramMDskin.com. Check out my free newsletter, KaramMD Journal. There's a link below that gives you all this stuff and more in a written form. If you haven't already, make sure you subscribe. And any questions or comments, drop them below. If you enjoyed it, just give me a like, so I know we're on the right track in serving you the way I want to serve everyone, which is to empower you to make good, solid decisions and ultimately look as young as you feel. All right, folks, thank you so much, Dr. Amir Karam.